Hello, I'm Dr. K, and this is Plastic Surgery One-on-One. This is your internet source for plastic surgery questions and answers. Today we're going to talk about capsular contracture, and that's a somewhat mysterious subject that has been with us ever since the first days of breast augmentation. So what exactly is it? Well, if you look at the pages of People magazine or various tabloids, and you see some of these young starlets with their really tight dresses and bikinis and cleavage, you'll see that occasionally one of them has a breast that's poking up a little bit higher than the other one, a little rounder, a little fuller, and doesn't look quite right. That's a sign of capsular contracture. What capsular contracture is scar tissue around the breast implant which has tightened. So whenever we put in a breast implant, regardless of whether we put it in through an incision around the nipple or under the nipple or through the armpit or above the muscle or below the muscle, the body forms scar tissue that forms around it. So this is a breast implant. It's a silicone breast implant, nice and soft and squishy. And this is roughly what the scar tissue looks like. It's literally this thin. It's a sheet of scar tissue that forms around the implant like a ball, and usually it is a large ball. So it's larger than the implant, and the implant actually moves around in it. And that's one of the reasons why we do exercises after the surgery to keep the implant moving around. But in some people, and the statistics vary, they can go from 5% to 30% in some series. In some people, that scar tissue actually shrinks. And as it shrinks and shrinks and makes the implant feel tight and hard and more like a ball. Now, there are a lot of theories as to why that happens. People talk about bacteria and biofilms, and that being the cause of contracture. Right now, the leading cause is some sort of minor infection. We all carry bacteria everywhere on our skin. During surgery, we sterilize the skin as much as we can by using antiseptic and antibiotic solutions, but the only way to totally sterilize the skin would be with a blowtorch. That would not be particularly acceptable. Also during surgery, we wear sterile gloves and use sterile technique, but a certain amount of these bacteria, a tiny amount, can actually get in some people, and they think that once they're on this scar tissue, they stimulate scarring. And sometimes we also see this much, much later when people have had some sort of illness, or even from something like dental work, where you get bacteria getting into your bloodstream, going round and round, and can wind up on your implant. So when this shrinks and gets hard, the breast can get firm. It can look odd because it usually rides up on the chest. It can also be quite uncomfortable because the scar tissue can pull on the nerve. So a long time ago, when all the implants were above the muscle, doctors would actually press on the breast and break this scar tissue. Unfortunately, it was only temporary and it would often come back. So there are a number of treatments that we have. The first treatment is what we used to do is vitamin E, and that actually works in some cases to prevent the scar tissue. What seems to work better is a drug called Accolate and another drug called Singular. These are both anti-asthma drugs. They're both anti-inflammatory drugs. And interestingly enough, one of my friends, Dr. Larry Schlesinger in Hawaii, discovered that accolate decreases the scar tissue, because one of his patients was on it for her asthma, and the scar tissue around her breast implants actually got better. People started using it and discovered that it did work. I've had excellent experience with this in the past. But one thing that people did find about this drug in general is that it can cause liver damage. So that has fallen out of favor as far as the drug of choice, and we now use something called Singulair, which is a similar drug, similar mechanism, and it does work on relaxing the scar tissue. The other treatment that we use is laser. I use cold laser to treat breasts after the surgery. We do it for prophylaxis. We also do it when people actively have the contracture. The laser, which is a special laser that is at a physiologic wavelength, and this increases the circulation, it decreases inflammation, and improves the healing process. Objectively, what you see is that it softens up after each laser treatment. This combination, in my hands, works on about 80% of people. Now, what about the 20% for whom it doesn't work? In those people, you actually have to go back through your original incision, or possibly a different incision, and release the scar tissue or remove it. The simplest case is if the implant is riding high, you just go in and make a little incision at the bottom, and that will release it by dropping it down through there. Sometimes, besides that, we make what are called radial cuts, and that can release it enough. If the scar tissue is very severe, or in cases where it's been around for a long, long time, this can actually be calcified, which means calcium deposits into this thin scar tissue, and it can actually look and feel like an eggshell. In those cases, we actually remove all of that. The radial and circumferential cuts are called a capsulotomy. The removal is called a capsulectomy. So, capsular contracture is something that can happen with breast augmentation. It has been around ever since the first days of doing the surgery. Each generation of breast implants has less problems with capsular contracture. Each generation of surgical technique has less problems, but we still are not down to zero. There are tools that we have that can help. There are also other drugs and other techniques, but this is a reasonable approach in terms of preventing capsular contracture and treating it. This brings us to the end of our tutorial. I'm Dr. Andrew Kaczynski of Advanced Concepts in Plastic Surgery, where art, science, and beauty come together for you. For more information, please come to our website, drkmd.com. Thank you.